Hey everyone, it's Dr. Bird with Chiro Movement. Today's video is on abdominal breathing. So a lot of people have a hard time with this one. We live in a society that tells us it's okay to breathe with our upper chest and suck in our stomachs basically. So what I'm doing with my hands is I'm trying to show you where you want to feel expansion when you breathe in is down into your core. Your core consists of your diaphragm, your pelvic diaphragm, your muscles in the front of the abdomen, the rectus abdominis and other muscles, the muscles on the side, and also the muscles in the back. They all help make the canister that we call the core. What you're seeing here is a couple of different positions. I hope that you can notice that the belly rises. What we want is our ribs to stay down in an unflared position, and as well, we don't want our chest to rise when we breathe. Our ribs are tucked down, and you can see my abdomen, my core, actually expands as I'm breathing in. So we use that box to kind of help guide that position. Now, I've got my hands behind my back right here, and that is to make sure that I can feel my muscles on the back side, the core in the back, basically, they actually expand as well as I'm breathing in. That way I know that I am expanding into all of my core, from the top to the bottom and all the sides. So I kind of think of it as a balloon. And here at the end is just some exercises that you can do. There's some variations within the dead bug position. That's what it's called. It's a dead bug. So this is just movement off of a stable base, which is the core at this point in time. These are all individual, and now you do a cross pattern. Both knee, leg, and arm go back on opposite sides. That's called contralateral, and then you're going to see same side, arm and leg go back. That's ipsilateral pattern. Alright guys, thanks.